Wonderful. Thank you, everyone. In recognition of National Rural Health Day tomorrow, today's Health and Action Workgroup will feature a presentation by Stephanie Pins of MyMichigan Medical Center Sioux. Stephanie Pins is the Director of Quality, Risk, and Compliance for MyMichigan Medical Center Sioux, formerly War Memorial Hospital. In affiliation with MyMichigan Health, Stephanie will be transitioning to Director of Value Analysis and Enhancement in January 2024. Stephanie received a Bachelor of Science from Northern Michigan University in Industrial Engineering and Technology and a Master's of Science in Healthcare Administration from Central Michigan University. Stephanie is co-leading the Health Equity Council for MyMichigan Health and has found that patient advocacy extends beyond the walls of a hospital. She led the creation of a transportation program for War Memorial Hospital by working with local transportation companies and applying for grants to cover the cost of the program. Stephanie is a TeamSTEPPS Master Trainer, Lean Six Sigma Greenbelt, and holds a Certified Professional in Healthcare Quality, CPHQ certification. Thank you, Stephanie, for being here today. Before you begin your presentation, I have some brief housekeeping items to review. First, this session is being recorded. The slides and the recording will be shared with attendees following the work group. Next, we will be monitoring the chat throughout the presentation, so feel free to add questions there. We also will have some designated time at the end of Stephanie's presentation for you to unmute and ask your question if you'd like to do that as well. Lastly, your feedback is very important to us. If you could please complete the post-work group survey in a link that will be provided following the work group, that would be greatly appreciated. With that, you are welcome to share your presentation. Stephanie, I'll stop sharing my screen now.
All right. Well, thank you, Christy, and thank you for having me to come talk about our transportation or non-emergency medical transportation program that we built here in the Sioux. With it being the National Rural Health Day, we are very rural up here. So, when we start looking at this information, a program like this is sometimes difficult to think about how to get started, but I've got some steps that I'd love to share with everybody on how to do that. So I'm just going to share my screen. I just want to make sure I get the right screen. How's that look, Christy?
I don't see anything yet.
Well, let's try that again.
So I can see the screen now. Okay, looks perfect.
Good.
Yep.
All right. So yeah, this is just kind of an overview of the NEMT program that we created here in the Sioux. Just some steps that we took when we started addressing this problem in our community. So I'm Stephanie Pins. Like Christy said, I'm the Director of Quality, Risk, and Compliance, transitioning to a Director of Value Analysis and Enhancement with MyMichigan Health. So a little bit about MyMichigan Health. We have medical centers, practice outpatient clinics. We have health parks, urgent care centers, walk-in centers, continuing care, long-term care, and other services that joint ventures that come along with being part of MyMichigan Health and the University of Michigan partnership. You can see MyMichigan Health services kind of the eastern part of Upper Michigan, and as of recently into the UP. That is the affiliation that we have becoming a partner with MyMichigan Health. But for the sake of this presentation, talk a little bit about specifically MyMichigan Medical Center Sioux. So MyMichigan Medical Center Sioux, we are a 49 acute bed hospital. We have primary care, we have specialty clinics. We are 51 bed long-term care unit, and we have a 20 bed inpatient behavioral health unit. A little bit more about our location. We are in the Eastern Upper Peninsula. We are the only medical center in the Tri-County. So I'm going to talk about Lewis County, Mackinac County, and Chippewa County. But there are two critical access hospitals that are Connect Care partners with MyMichigan. They're not MyMichigan, but they are partners with us. One is located in Lewis County and one is located in Mackinac County. So when we talk about the communities that we serve here at MyMichigan Medical Center Sioux, it is that Eastern Upper Peninsula that we're going to talk about. And just to kind of put some context on how rural it can be up here, we talk about Chippewa County, one of the largest counties at 36,000, and the population being over 36,000, but that equates to about 23 people per square mile. When we look at Luce County, their population is just over 5,000, or a population of almost 6 per square mile. And then Mackinac County at almost 11,000 and almost 11 per square mile. So pretty rural when you get up into the eastern part of the UP. Some of the services we offer here at the medical center, like I said, we have inpatient behavioral health, but we also have outpatient behavioral health. We do cancer care, cardiology, ENT, maternity, pain management, pediatric, rehab, sleep, and wound care. But when you look around some of the driving distances that patients need to go to get to the services we offer, those of you that are familiar with the Eastern Upper Peninsula, we have an island that is in our county, and it could be 70 miles one way to get to an appointment. So if they had a cancer care appointment, a cardiology, ENT, they would need to drive 70 miles each way. St. Ignace, so if someone was in St. Ignace and needed our services here, 50 miles. Eckerman would be about 40. And then there are some things that we don't offer. So patients need to go probably to the closest location, which is often Petoskey, which is 95 miles one way. And as you can imagine, this would put a burden on some of the families. And of course, the social determinants of health, everybody's kind of focused on this right now and doing a lot of work in this area. CMS has implemented that required screening of SDOH for 2024, which is the screening of those 5 factors: food insecurity, housing instability, utility difficulties, interpersonal safety, and transportation needs, which I'm talking about today. But it's, in the health equity work that we're doing, it's one thing to just screen, but once someone screens positive for any one of these social determinants of health, it's what do we do to help that patient get the care that they need and get the assistance they need to have better outcomes. This transportation program, I will say, is one of those bucket filler programs that I've been able to be part of in my career, and just really makes me feel good that I was part of creating something like this for our community. At the recent MVC meeting, this was great information that they shared, so I asked if I could put it in here because it really highlights, the need in the Eastern Upper Peninsula. So this is the percent of housing units with no vehicle. So no vehicle at all in the household. It could be in the driveway, not running. They could not own one at all. But you can see that Tri-County, Mackinac and Chippewa being some of the worst counties in the state for no vehicle at all. And as you saw, the distances that patients have to go to receive healthcare services, it only impacts that even more, because then they really, can't burden a neighbor or a family member to come get them and take them to their appointments. So really interesting information showing that Mackinac County is one of the worst, other than Wayne, in the state. And Mackinac County does not have the public transportation that would be available in Wayne County. So MyMichigan Medical Center Sue came up with 2 different transportation solutions. I'm going to go through both of them. Please take something or nothing or all of it from what I present. They're both fantastic programs and really well used. So the first one is going to be Road to Recovery, and the second one is Rides to Wellness. The Road to Recovery program is a partnership with McLaren Northern Michigan. We provide some oncology cancer treatment services here, but we don't provide radiation therapy. So any patients that need that radiation therapy has to travel to Petoskey to receive that. And sometimes if you're going 2-3 times a week, that puts a large burden on the family. So we created a totally funded program with donations from the public. McLaren Northern Michigan participates. It's available 5 days a week. Anyone from the Eastern Upper Peninsula can utilize that transportation service free of charge. We pick up along the I-75 corridor, so it will leave the hospital. Patients can come meet the driver in the van here at the hospital, and then their scheduled pickup times along I-75 all the way down to Petoskey. We do use volunteer drivers for this service. The hospital owns the vans, but the drivers are 100% volunteer, and they are passionate about it. They are dedicated, and we have one staff member that just kind of manages that process. We do coordinate service times with McLaren Northern Michigan, so that everybody we know that is using that service can have a scheduled appointment time together. So the whole van goes down, everybody receives their services, and the whole van comes back together. It's one thing to provide that transportation to those patients, but that service has done a lot more than just provide the transportation. You've got now a group of people in a van for probably an hour and a half, all kind of going through the same experience, and they start to kind of build relationships. And we've gotten a lot of feedback from patients just about, it was nice having somebody else going through the same thing that you could kind of talk to. I mean, families definitely understand, but when you have someone else going through that exact same thing, they kind of start building those relationships naturally. And that's been a high point that some of the patients have given us feedback on. The other one that I'll go a little bit more in depth on is what we call Rides to Wellness. This is for all of those other appointments or patient care services that patients need to get to and from. We started this program in 2019, right before COVID hit. So we just got our feet up, on the ground, and we were up and running. COVID hit. And of course, we had to cancel the transportation for the most part. We did start out with a grant from the Superior Health Foundation for $64,000. And one thing we learned from doing the Road to Recovery program is that we are not in the transportation business. We are not in the business to manage volunteers or upkeep on vehicles and just manage all of that stuff. We do it really well from the Road to Recovery, but it was not a model that we wanted to carry over into Rides to Wellness. So what we did is we set out and we partnered with local transportation companies. They have the drivers. That's what they do for their careers. Their drivers, they know how to manage that. So we approached UPTA and Community Action, who operates the Rides to Wellness here in the Sioux. With that $64,000 from the Superior Health Foundation, we purchased 2 minivans for the agencies. We didn't want to manage them from a hospital standpoint, so we gifted 2 vehicles to those agencies, and they provide the drivers. They train the drivers, they schedule the drivers, and they manage that piece of it. And then for operational costs, we received United Way grants for approximately $8,000, which kind of helps us fund the operation of that program. So like I said, we use traditional busing. These are the buses that, we traditionally saw on the road in Sault Ste. Marie going around. The dial-a-ride bus, this was more of, they did have on demand, but it wasn't 100% guaranteed that they would be able to take you where you needed to go. So these 2 vehicles, you see the smaller ones, we purchased a minivan with a lift, and we actually purchased UPTA a minivan, and they put so many miles on it, they needed to purchase a new one. So they bought a Jeep there. So that is what you've done. It's kind of like a Uber type service. We coordinate the ride up at their home, take them to their appointment, pick them up from their appointment when they're done, and take them home. There's a lot of coordination that goes on there. The one thing we found while doing this is we needed to make sure that the patient was ambulatory. There was a handful of patients that needed a little bit of assistance, and that's something that the drivers were giving us feedback on. This is they don't feel comfortable going into the patient's home and helping them walk out to the van. That was just a little bit more of a liability on them than what I think they could take. So we need to make sure in future screenings that we really screen them to be ambulatory, to get themselves out of their house and into the vehicle. That was one thing we learned. We also partnered with Connect UP, or it's also the MTC, the Michigan Transportation Center, to help coordinate. We did find that it is a lot to be calling and setting up all these rides. This is a program they serve or provide, lower Michigan and now in the UP. It is nice just to have someone kind of help call and coordinate those rides. We do have one coordinator here at MyMichigan Medical Center, Sue. That coordinator is actually our president's administrative assistant. It's not a super demanding piece of it. It's just making sure that we're managing what rides are approved and processing payment for the rides that are approved. We worked a lot with staff because there are non-emergency medical transportation benefits for different payers. So Medicaid, our local Medicaid office has volunteer drivers that they manage to take their patients to and from appointments. The one thing we found in working with Medicaid in these requests is they require a 10-day advance notice. And sometimes they could not always provide the driver because it is volunteer. So again, we worked with that Medicaid office and said, we'll put in that request first for you to, provide that ride to the patient, knowing the most important thing is getting that patient to that appointment. And if you can't cover it, will you cover the cost of us scheduling through this Rides to Wellness program? And they said yes. So we've created a fantastic partnership with our local Medicaid office, and it's working really well, making sure patients get where they need to go. UPHP or Downstate United Health. So I know UPHP provides that benefit to their beneficiaries as well. They just need a 7-day advance notice. So it's
Oh, Stephanie, I think we may have lost you for a second.
provide that ride to the patient. Then we will cover that with our grant funds, but we need to make sure that we seek that out first. And then Medicare Advantage, they offer some NEMT benefits for their patients as well. So it's just working with staff and training them to understand what is covered with what they have and where we can supplement and help them out. So for Rides to Wellness, there are no restrictions on distance. Our focus here is really population health. At Petoskey for eye appointments, we don't look and just say, okay, if it's not a MyMichigan facility, we're not going to transport you there. We know the overall health of the patients down the road is the most important thing. So we do have a lot of patients going to Petoskey for eye appointments, cardiovascular services. We have taken patients to Henry Ford, other MyMichigan locations, or even discharges from MyMichigan locations. So if a patient is transferred down by ambulance and discharged, that family has no way to get them back. We can deploy some of our NEMT services down to bring them home. Discharges home. Sometimes, if a patient doesn't have a ride or anybody that can come get them from the hospital until later, we can coordinate some of those rides and get them home sooner. We do look at using the most economical solution. So if there's, a cab that can take them, dial a ride, we look at kind of the best option for the patient and where they're going. That's a little bit of the administrative piece that we do. I thought I'd share this because, again, like I said, this has been kind of my bucket filler program that I've been able to be a part of. But this is kind of a patient testimony that they sent in, just saying, if it wasn't for this service, they can imagine what would have happened. So it's the feedback like this that kind of really warms your heart and lets you know that you are doing the right thing for the right reason. Yeah, and the one thing I can say, I know, when we talked about we need a transportation program, it's like, well, where do you start? Where do you even begin? But I love this quote. It says, you don't have to be great to start. You just have to start to be great. I'm sure Michael Jordan didn't start out dunking, he had to walk first. So that's really, if you're looking at starting a transportation program for your organization or your hospital, just start. So just start having conversations, just start thinking about how and who to partner with in the community. So I did add on here a couple of just tips to start. I thought, this would be great to add on here because, lessons learned from us you can take. Some of you may be further ahead than us. Some of you may have not started at all. So hopefully you can take something away from here. Just create partnerships. You can't do this alone. Set out, do those cold calls, knock on somebody's door. That's what I did with UBDA and said, hey, we have this idea, and they came to the table. And the same with community action. They were all about it. Think outside the box, you know, don't be afraid to propose something and then work on it from there. Don't think it's just got to be a cookie cutter project. It's really about making things work and tailoring them to what works for you and the area that you serve. Seek grant funding. There's so many grants available for social determinants of health and things like this out there. You just need to kind of find them, and the funding is great if you're in a small rural hospital and you don't necessarily have extra funds, or you go to your president or CEO and ask for money, and you know, it's always a no, because that's not something that's top priority right now. Grant funding is a great way to kind of supplement that. Understand what benefits are already currently available to your patients. Different payers have different options. A lot don't, but understand what's available to your patients and build working relationships with those payers. That way you're getting the best outcome for your patients. And start small. Pilot a program with one clinic's patients. You know, you don't have to start and scale it out to a whole organization. If you just have one, say a primary care physician that you want to start with, and you have a few grant dollars, and you just want to call your local transportation company and said, hey, we've got this idea. Just start small and scale it up from there as you get your lessons learned. And then really educate your staff on the program. This is one thing with the staff turnover. We have to keep going back and educating staff to make sure that they are offering rides when they screen that someone needs it, or if they are something that they pick up on of why the patient maybe couldn't meet their appointment. Now, once we start screening for those social determinants of health, it's going to make it a lot easier to know who it is that needs transportation services on the acute care side. We've been doing that in the ambulatory side, and we did take those questions and align them. So they're looking at the same questions in the acute that they are in the ambulatory, and lining up that way. I think that's really the sum of it. Great program, great partnerships, and I'm just so happy that I could share it with you today. And that is really all I have for my presentation. Are there any questions?
Thanks so much, Stephanie. Does anyone have any questions? I could go ahead and get us started with, oh, we see one question from Tara Perlman in the chat. Is there any way to plan to share the slides? I would love to review them again. Yes, we will be sharing the slides following the work group. We'll be sending out an email to everyone who registered. And then I did have a question for you. Could you tell us a little bit about one of the biggest barriers that you faced when implementing this program, and how you overcame it, or particularly if there were any like unexpected challenges that you faced that you didn't think about, you know, when you were implementing or designing the program?
Yeah, absolutely. One of them that sticks out is, you know, we were getting feedback from the community about, why aren't you advertising this? Why aren't you making patients more aware of this program? Because it is a fantastic program. And it's hard to explain that we have limited funding, and we want to make sure that we're focusing on the patients that need it the most, and not, you know, we can't just, it would be great if we could offer rides to everybody who needed to get where they needed to go. But right now we're just really focused on those that have a true barrier in getting there. So I think just putting words behind that and communicating that to our community was a big kind of hurdle to get past. And we still kind of have to work on it.
Definitely. Thank you. So a comment in the chat, Jessica said that she loves the quote that you put in there of, you don't have to be great to start. I loved that as well. Does anyone have any other questions for Stephanie?
Identifying grant funding, sure. I would, recommend starting with the local United Ways. There's United Ways in every community. And even if you go on grants.gov, you can search all of the grants available out there, and there are so many. So those are kind of two main places I would direct somebody to look for grants. And then even just sometimes going into like Google by area and typing in, transportation grants or just some buzzwords that may pull something up, because, they don't always make it super well known what grants are available if you're outside of that kind of circle. Question for the group. Is anybody else already doing anything like this or planning to start a program in 2024?
Hi, my name is Jennifer Dyke. I'm from ProMedica Hickman in Adrian, Michigan. And in the last year, we also partnered with MTC and started a similar program. And our population health director was able to secure some grant funding for that. And it has been a help in getting, especially being in a rural area, because MTC, they kind of secure, they develop, they collaborate with multiple different transportation providers. So MTC kind of becomes like a one call to secure transportation for our patients. Been a big help.
Thanks for sharing.
Can I just ask you, do patients set up rides for themselves, or do they contact somebody? Like, are they?
We have a single point of contact for the hospital, and that's the health supervisor on duty. And then we connect with MTC.
And I know MTC has been talking about getting an online access portal, which would be even better yet, so we could eliminate some phone calls.
Wonderful. Does anyone have any other questions for Stephanie?
Well, thank you everybody again for letting me come and share this program. I'm really proud of it and some of the work that we've been able to help our patients with. So thank you.
It's amazing. Thank you so much for sharing. Before we end the work group today, I'm going to go ahead and bring up my screen again and review some upcoming events that we have for MVC. Let me get to the end here. Okay. Wonderful. Thank you again, Stephanie, and thanks everyone for being here today. Before we conclude, I wanted to share some upcoming events. So on the screen here, you will see the work groups that we have for December. The first work group of December will be a cardiac rehab work group, and that will feature MVC's project manager, Jana Stewart. That is going to be on December 7th from 2 to 3 p.m. And then following this work group, we have a chronic disease management work group on December 14th from 11 to 12 p.m. With presenters Karen Newman and Kathy Brzezinski from MyMichigan Health as well. So we're looking forward to both of those presentations to conclude our 2023 work groups. Some exciting news moving into 2024 is we will have a dedicated rural health work group series. So that is going to consist of 4 individual rural health work groups. So we hope to see everyone there who is working in a rural community, and it's really great to have everyone together in the same space to continue these conversations. So with that, as a reminder, today's work group slides and recording will be shared following the work group. If you have any questions at all, please reach out to us. Thank you again for attending today and for your support of MVC, and we look forward to seeing you at future events. Have a great day, everyone.